So now we had seen about all the neoplastic pathology and non-neoplastic pathology related to WBCs. So let's have a quick recap of the various markers. We have read about so many CD markers, right? So I'll give a quick recap here. So what are the B cell markers? So firstly, CD19, CD20. Apart from that, CD21, 22, 23 can also be there. CD79A, PAX5. So all of these are B cell markers, and in this CD19 is going to be the pan B cell marker. So T cell markers, everything from 1 to 8 you can write except for 6. So CD1, 2, 3, 4, 5, 7 and 8. Out of this, CD3 is the pan T cell marker. Germinal center markers are going to be CD10 and BCL6. So these were positive in follicular lymphoma, DLBCL and Burkitt's lymphoma. Then NK cell markers. NK cell markers are CD16 and CD56. So CD56 I mentioned, it can be aberrantly expressed by various lymphomas and also in the multiple myeloma plasma cells. Monocytic markers are going to be CD14 and CD64. Okay. So myeloid markers are going to be MPO, CD13, CD33 and then CD117. Then RS cells, the classical RS cells are going to be positive for CD15, CD30 and attenuated Golgi positivity for PAX5. So CD30 can also be expressed by this one thing was this classic RS cell. Then ALCL was also positive for CD30. Apart from that, something unrelated to the WBCs, yes, it is going to be expressed by embryonal carcinoma, which is a germ cell tumor of the ovary and testis. So embryonal carcinoma will also be positive for CD30. CD15 again expressed by the classic RS cells. Apart from that, CD15 will also be positive in the mature granulocytes like neutrophils. 15 and 65. Okay, usually granulocytes are positive for 15 and 65. Then CD1A and CD207 is going to be positive in LCH, Langerhans cell histiocytosis, and the CD207 is called as Langerhans protein. Then CD11C, CD25, CD103 is going to be positive in hairy cell leukemia. Out of this, CD25 can be positive in Treg cells as well. CD21 is a B cell marker. So it is also called as complement receptor 2 because it is going to act as the receptor for EBV to enter into the B cell. So EBV receptor is CD21 or complement receptor 2. CD31 unrelated to this. So where did we see? We saw it in general pathology. It is the PCAM1. CD31 is also called as PCAM1 involved in the diapedesis. So the WBCs are coming out of the vessel into the extracellular area, right? So that is the CD31 diapedesis PCAM1. CD34 is a vascular marker basically. So CD31 and CD34, both of this is going to be vascular markers as well. Apart from that, CD34 is going to be expressed by the hematopoietic stem cells. So stem cell marker is CD34. CD45 is the leukocyte common antigen. So it is going to be expressed by all the lymphomas and leukocytes, but it is going to be negative in, so I'll mention, it is going to be negative in classical RS cells and also in multiple myeloma plasma cells. Okay. CD45RO is going to be the memory T cells. It is a marker for memory T cells. CD45 is for LCA, 45RO is for memory T cells. Then we have CD41 and 61. It is going to be the marker for megakaryocyte. So this was used for AML M7, right? Then CD71, it is also called as glycophorin A. So glycophorin A is a membrane protein in the RBCs. So it is going to be seen in AML M6. Then CD68 is going to be a marker for macrophages. So anywhere if you want to highlight the macrophages, you can give a CD68. Then CD68E or CD68L these are selectins actually. These are positive. These are this other name for the CD68 E and L is the selectin. So E selectin and L selectin. So selectins were involved in the addition step of inflammation. So CD55 is also called as DAF, decay accelerating factor. Then CD59 is called as membrane inhibitor, MIRL, MERL, and these two are going to be involved in the pathogenesis of PNH, paroxysmal nocturnal hemoglobinuria. So GPA anchored proteins are not going to be there. So this DAF and MERL are not going to be there in PNH. So CD95 is FAS. So FAS was, we studied that in extrinsic pathway of apoptosis. CD99, it is a non-specific marker, but we can use it in Ewing sarcoma. Okay. So Ewing sarcoma was also positive for FLI1.